What is up, everybody? Welcome back to your favorite podcast, We Run on
Oh, yeah,
Coffee.
yeah,
I'm
yeah.
Erica,
And I'm Marissa.
and we're bringing you today one of our little researched educational medical episodes. We do a lot more medical episodes than I would have thought, considering my personality personally. So here we are, though.
Erica's like,
I'm
I
excited.
actually don't know anything about
I
anything.
don't, and I don't, nor do I like it, but here we are. But I actually love every medical one we've done. We understand ourselves so much better now. I just love it.
Yeah,
It's fun.
the female body,
Female body. Yep. That's what we're back to talk about today, honestly.
Yeah,
And me and Marissa just had a big catch up off camera. So I just feel like so weird that I'm like, what do we talk about now? We've been
I
chit
know.
chatting so much,
Well,
but
we're not supposed to catch up. We're supposed to talk about what we're looking forward to. So
true.
that's
And you know
okay.
what? I didn't prepare either. I would do
Oh,
that.
that's okay.
But what are you drinking? Let's start with that before we get too tangenty as we
If
often
you
do.
listened to last week's episode, you know that I have an apple cider this
Cute.
week.
I love
So
it.
I have it cold. That's
Love.
normally how I have it because I'm
Me
too
too.
lazy to warm it up
I love it.
unless I'm outside and like order it at
Has to
somewhere,
be a vibe.
then I
Yeah.
want it warm.
Yeah.
But just regular apple cider and it's very yummy.
I
What are
love
you drinking?
it. I'm drinking, okay, I have the trio right now. So you guys, this is a new cup. First of all, you guys can see my
I
new
have a
cup.
new cup.
You do?
Yeah, you
Wait,
show yours
twins.
first.
Yeah, this is this is a Hydra Peak. I didn't buy it. My cousin Delaney gave it to me, so shout out Delaney, because I always say I want this like white leopard print of the Simple Modern cups. She's like, "Oh,
Mm-hmm.
I have that and I don't want it anymore." So she gave me this. So it's a Hydra Peak and it's really nice. I actually like how the handle doesn't attach because I've been hanging it on stuff. It's really convenient.
I've seen like people hang it on like shopping carts, like
Yeah, I
grocery
hung it
carts.
at the air show. I hung it on the side of the camp chair, and it was like really nice because I didn't have to put it on the ground
Ah,
outside, and there were ants. So I was like, wait, this is nice.
yeah.
But then I also have my coffee. That's drink number two.
And
Drink
number
trio.
three?
Number three is my Waterloo Cherry Limeade.
Mm-hmm,
And
mm-hmm.
shout out, I'm using a little I won't show the back because it has personal info on it, but Angela's
Head
cousin's
over
wedding,
boots.
it was a little wedding favor thingy is the koozie.
Yeah,
So they did Head Over Boots for You, which is a country song. Little koozies. So that's what I'm using. What
I
are
love
you?
it.
Oh, you're drinking the apple cider. I almost said, what are you drinking?
Yeah, and then I got a new cup. So
Yeah,
this
show
is
us
a
the new
new
cup.
water bottle. And
Ooh,
Erica, you're gonna know what this is. Every time
I
I
am.
say the
Okay.
Chip and Joanna Gaines section
Oh,
at
yes,
Target,
of course.
everybody says,
Hearth and
huh?
Home or whatever it's called. Like,
Yes.
yes, of
You're the
course.
only
What?
person that I've said that to the past three
Girl,
weeks since I got this water bottle that is like,
what?
yeah, I know what that
Of
is.
course I
And
know
I'm
that.
like, it's the part that like looks a little bit more like homey, a little bit more country,
Yeah, farmhouse
rustic in
cup
the
vibe.
Target. And they're
Yes.
like, I don't know what you're talking about. I'm like, you're
What?
crazy.
You don't go to
But
Target enough.
literally, but I was walking by and I wanted a new water bottle and
Yeah.
I wanted this specific kind that I'll show you in just a second.
Okay.
But I couldn't find the water bottle section and neither could Kyle. So we like walked around and
Oh,
then we were walking by and I was like, that one's so
wait, I'm so
pretty. And I
excited.
was like, I don't need it. It's like $25.
Right.
Like, I'm okay without it. And Kyle was like, you really want it. You've been thinking about it for a while.
Yeah.
Go get it. So
Sometimes it's
I
worth it. Oh,
did.
so sleek. Is this an Owala?
It is an Owala.
Yeah, that's
It's the
cute.
one that has like the little
Yes, this
pop.
is
I
Grace is
can't
gonna
remember
be
that.
so happy. Grace and Lauren are so
One of
on
these
this Owala
guys.
thing.
I
Yeah.
love it. I
So
drink a lot of
cute.
water out of it. It
Good.
feels so much cleaner than my one that has the straw, even though I put my
Good.
straw topper on it.
Yeah.
And I love it. It's like classic,
It's
like
very sleek.
fall
Yeah.
colors, but I think
Love.
it's just like their collection that they
Is
had
it
with the Walla.
is it tan or is it purpley toned? I can't really tell completely.
It's tan, a darker brown, lighter
Okay, I
brown.
see. Yeah, it was looking a little purple tone. I was like, I'm not sure if it's purple or
This
neutrals,
is a
but that's cute.
little, it's a little
It's
like
kind of
mauve
Yeah,
brown.
it's kind of giving We Run on Coffee colors. Like our little
I
three
know.
color trio. Wait, that's so
A
cute.
Walla sponsor us.
Literally, send me one. I don't have one, so just saying. That's
Yeah,
so cute. I love it. Of course I know the Chip and Joanna Gaines section. I have a mug from there as well. It's really cute.
that's what
I
I'm
feel it.
saying. I feel like it's more expensive than everything else in Target, but it's cute. So
Yeah.
that's all that matters.
Yeah. Okay, well, now that we know what we're drinking, I'm just making some notes of what to put in this.
Chip
If you know,
and
you
Joanna
know.
Gaines
I'm gonna
section.
put it in
That's
the if you know,
so
you know
funny.
stories. So if you know, you know, which apparently people don't. Rude.
Apparently they don't know.
So yeah, what are you looking forward to until next time we
Okay.
record?
So I forgot to say this last week, but if
Okay.
you saw our Instagram stories a couple weeks ago for an episode, and then
Yeah.
if you know, you know, there was like a tattoo photo because I was
Yes.
supposed to get a tattoo.
Yeah.
My tattoo artist grandma passed away, so I did
Oh,
not get a tattoo.
I saw my friend Cree DM'd and then you responded because I was on the cruise and I thought that was so funny. I was like, I love this.
I was like, yeah, I did not get the tattoo. So that appointment's
Sad.
coming up in like 2 weeks. We rescheduled.
Yeah.
And if anybody doesn't remember what I'm getting little stars and
I
fireflies
can't
on
wait
my
to see
arm,
it.
and I'm very excited. And
Yes.
then what else am I looking forward to before we record next? I'm going to Ohio for Labor Day to see my parents, which by
Fun.
the time that this happens has been long gone. And then I get to dog sit my friend's dog Teddy while we have
Oh,
Kyle's friend Ethan in town. So that'll be a
fun.
busy, crazy
Wait,
weekend.
I remember seeing a picture, but what kind of dog is Teddy again? I forget.
He's a
Like a
golden
doodle?
doodle.
Okay, that's what I
Hmm.
thought. I remember.
So Scarlett gets to have a friend
Ooh,
a friend
play
here
date.
for yeah, play date
That's
weekend
fun.
thing. That he's gonna be here for like 2 or 3 nights, and
Oh,
then the weekend after that, we're going back to Ohio for
wow.
Kyle's little brother's football game so we can watch him.
That's
We're not
fun.
able to go to his senior night because we're going to be on our anniversary trip. So
Yeah, that's
we
coming up
had to
quick.
pick another date to go. But they
Yeah.
actually live streamed the game. So we watched the
Oh,
second half this week on Friday of
that's
him
cool.
playing. And he got a lot of tackles. He was doing a really good job.
Wow. I love that.
And the school, why was I going to say Ohio State? That is not
That's
what
funny.
is true. The school that he plays for,
Yeah.
they won like 70-13 or something.
Whoa. Oh my
It was
gosh.
crazy.
That's so
And
funny.
the last play of the game, Erica, it was a kickoff. So like when they one team kicks it to the other team and then
Yeah.
they grab the ball, he ran it for a touchdown for the last play of the game.
Wow. Just to rub it in.
Yeah,
Just to
they
finish
ran
us off.
all the way across the field. And I was like,
Aw.
oh my goodness, that's crazy.
We went to one of his games last year and he didn't know we were coming. We surprised him. He was so shook, but it was so much fun. I loved doing that. It's such a like it reminds me of my high school nights because it's about the same size as my high school and same school colors, which is funny. I'm like, this is very nostalgic.
Yeah. And then I feel like we don't record again for a while because my trip, so then it's Kyle's birthday, and then Kyle's mom and her boyfriend are coming to visit, and then we
Fun.
go on our anniversary trip, and then we still don't record for another week.
No, we have one in 2 weeks.
Oh,
I
where
was
am
like, wait a
I?
second. I don't know, but September
Oh,
7th.
well, ignore everything that I just said. That's what I'm still looking forward to.
Yeah,
So,
we'll still be looking forward to it then.
yeah.
That's good. Wow,
Uh,
that's a lot going on.
that's so soon that we have to record. I'm not prepared.
I know. I know. We're so like crazy right now with the
I
schedule.
know.
But
Maybe
I
in
don't
like
have,
December I'll be free.
yeah, we'll see. Maybe next year. I don't have any looking aheads. Like, I literally just looked at my calendar. There's nothing going on. Just life as usual, working on the house, getting things done. I mean, there's plenty to worry about. My car needs to go to the freaking shop because my car has a light on it that, or like a screen thing. What's it called? Like a notice. And it says engine maintenance required. Visit dealer. Now, sometimes it will say like something similar to that, and it means oil change. It's like basically a code words for oil change, and we'll change the oil. This is a different message, and what's weird is that the engine light is not on, check engine light is not on, and Angela plugged in the OBD2 reader or whatever it's called, sensor thing that reads the codes of the car, and there's no codes. It's literally just the
Oh.
freaking message. So annoying, but you guys know I hate fucking calling anyone and I don't want to call them and talk to them. Angelo actually said he's going to do it, so we'll see if he does it on Monday, but it's just like a stressor in my life. So I guess that's what I'll
Hmm.
be doing. But I don't have any like big events coming up. I'm just life as usual until we talk
You want
again.
to switch?
Yeah, honestly. I feel like it is true though that we always do this. Like one of us is always crazy and then the other one's like, I don't got anything
I
going
need a
on.
break, Erica.
Yeah,
Switch.
literally. No, I feel like it's wild these days, but that's what's looking ahead. I guess that's
Yeah.
it. We can dive in. We have a lot to talk about today. I'm very excited about this. It's kind of a random topic that this topic chose me. I didn't choose this topic. This topic chose me, honestly. But I do want to say be sure that you guys are watching this episode on Spotify or YouTube today. If you want to see like the images and charts that we're going to put in that really help with the explanation, I actually have a drawing from my doctor that I recreated on like Google so that I
Oh.
could show it to you guys because I feel like it's really illustrative and helped me understand what we're talking about today, which is endometriosis. Yay!
Yay. Maybe not yay,
I know.
but
Yeah. So of course, I used Cleveland Clinic, my favorite resource when we do a little medical
And who
episode.
else would we use?
Who else would we use? Forget Mayo Clinic. I'm always using Cleveland Clinic. It's my favoriteest one. So, Cleveland Clinic endometriosis page is what I used for this episode. But we're going to jump in. I'm going to tell you like a little story time, and then we're going to get into what endometriosis is and kind of
All
how
my
to
cords
manage.
are wrapped.
Oh,
Okay, I'm
oh.
better. I'm
Marissa's
better.
unwell. Marissa's unwell.
I'm always unwell. It's
Yeah,
okay.
we're in an unwell state right now. Yeah. So, first of all, we're going to start with story time. So, Marissa kind of knows this because I told her off cam, but you guys don't know.
Like
I,
half.
yeah, we don't have the whole story because honestly, a lot has happened recently. But I basically started having these weird spasms on my stomach. So if you guys know what it's like when your like eye twitches involuntarily, like it does a little spasm, I was having that, but on my stomach, and it was so intense and strong. You could see it through my denim jeans, like full denim jeans, like really thick jeans. You could still see my stomach moving and spasming. So
Mine
strange.
does that sometimes, but it's like it's just like a twitch.
Yeah, it was like a twitch, and it was happening a lot though, like every day and really strongly and for like a few minutes at a time. And I let that happen for like a month before I was finally like, okay, maybe I'll see a doctor, which is honestly shorter than I usually would. Like wait until going to the doctor. But I was like, yeah, we might as well check it out. So I went to just my regular family doctor or whatever. You guys know, my DO. And I talked to her about it, and she was like, that is interesting. And I really don't know what would be going on. So let's just order blood work first of all to see if you have any, like vitamin deficiencies, whatever.
Yeah. Things
My
that
blood
normally
work,
cause a twitch.
yeah, things that would cause a spasm, and she was specifically looking at certain vitamins and stuff like that, and iron. And I was fine. All my stuff was good. And then she was like, I'm also going to order at the same time a pelvic ultrasound, and you're just going to get like an ultrasound done and see if they see anything. So
Hmm.
that was I specifically asked her too. I was like, okay, so what even is that? Like, are they going to use the probe, to get in there, or is the outside ultrasound? She's like, no, outside of your stomach only, like a stomach and pelvis area ultrasound. I'm like, okay, cool. So she ordered that too.
I think it's crazy. I've never had a stomach ultrasound. I've had a boob ultrasound,
Oh,
but
yeah. This is
just
my first
because
time.
I
Yeah.
have fibrous breast tissue, TMI maybe,
Oh,
I guess,
okay. Well,
but
this whole episode's about to be TMI,
I have
honestly.
fibrous breast
That's
tissue,
interesting.
which
Yeah.
can lead to like it can sometimes mean you have a higher risk for breast cancer.
Oh,
And my grandma had breast cancer. So
yeah.
I had like it felt like a cyst in my boob
Mm-hmm.
and it hurt. Like when I
Yeah.
would wear like
Ooh,
bras, like it hurt.
that's not
And
fun.
it was hormonal too, because since I've
Yeah.
stopped taking like the pill birth
Oh,
control,
yeah.
it's gotten better and like my breast tissue is less dense.
Yeah.
But I mean, it's still a bit dense, but my boobs
Yeah.
don't hurt as bad
Dang,
anymore.
that's
But
interesting.
always get your boobs checked,
Yeah, I was
ladies.
gonna say, you guys, if you have family history of anything, get it checked out earlier than you would
Yeah.
think.
And sometimes they said dense fibrous breast tissue. And if you
Hmm.
have that, you should go and get ultrasounds and like your mammograms maybe a bit more frequently. They never told
Right.
me anything because they did think it was like hormonal causing it. And like
Right.
I changed the hormone thing. So I don't have to go like every year, but I might
Yeah.
have to as I get older.
No, that makes sense. Um, yeah, so yeah,
Anyways,
I forget how
you
we
got
got
the
on this
belly
tangent. Oh, the
ultrasound.
ultrasound. Yeah, okay. I was like, I forgot how we got here. Yeah, so the ultrasound. So she ordered it and I had to go get it done at a hospital, right? So
Hmm.
I went to the hospital. First of all, they wouldn't let Angela in the room with me, which now my gynecologist told me that should have not been the case, and they're not allowed to deny you to have someone with you. That it's a
Like
new
a
law in
companion.
Ohio. Yeah.
Yeah.
She said it's a newer law, but that should not happen. I was like, oh, okay, cool. Because they literally told us no. She was like, no, sit down. Like, I'll bring her out when she's done. We're like, cool.
Well, now
So I
you know to
went in.
advocate for yourself in the future
I
because you know it's a law
exactly.
now.
Yeah. So I went in with this girl, and the girl was super nice. She went to high school with Grace and like graduated in the same class, which is just
Oh,
funny. I
that's
was like,
funny.
"You're younger than me. It's so funny that like you're doing doctor things on me." But
Yeah.
she was super nice, and she was like, "All right, so I have you as we're walking. She's like, I have you down for like the pelvic ultrasound, and then also a transvaginal ultrasound, which I know means the probe in your vagina." I was like, "Oh no, thank you. What are you talking about? Like my doctor said I'm not getting that." She's like, "Well." Your doctor ordered that. I'm like, cool. Who's gaslighting me here? So either the
Yeah.
doctor forgot that she was not going to give me that, or what she lied. I don't know what
Or
happened.
maybe she decided later that she needed it and
Yeah.
added it to your
And no
order.
one told me. And I'm not mad at anyone because I love my doctor and I loved the girl, but I was just like, this sucks. And she was like, you can deny it. Like, you're the patient. You have every right to say no. And I'm like, if
And
the
you're like, well,
doctor
I need to
wants
figure
it,
out. Yeah.
yeah. I'm like, if the doctor wants it, I might as well just get it now. I don't want to come back and ever have to do it again. let's just do it now.
Hmm.
So we do the transvaginal ultrasound, you guys, horrible. The girl tells me, oh, if you've ever had a pap smear, have you? And I was like, yeah. And she's like, oh, I have heard all the time, like, it's not even as bad as that. It's less bad than that. She was wrong, in my opinion. And also,
It just is so invasive.
she's
Like,
never had one. I'm like, what are you talking about? You're just talking about
yeah,
what you hear.
it's
But
also like
it's
it's
longer.
it's not like I guess I've never had one. I'm just guessing.
Yeah.
Like, it's not like obviously it's uncomfortable. It's just
Yes.
like, ugh,
It's uncomfortable. You can feel your organs moving around. It's
ew.
very, yeah, it's
That
very, I
part would
can't
be the
even,
most unsettling.
it's
Not like having
gross.
it poked
It's
inside of
weird.
me. It would be that.
It's prolonged. A pap smear is pretty fast. This was
Yeah.
like many minutes and it's just not comfortable. So anyways, don't recommend, but if you have to do it, you have to do it. So
Yeah.
I get the outside ultrasound done and she's like putting the thing literally like a pregnancy ultrasound. And she's like, "Okay, I see like your right ovary, whatever." And she's like telling me what she sees. And then she's trying to find my left ovary and she can't. She's like, "I can't find it. It's like really buried in there or something." So she's like, "Honestly, I'm going to have to Oh, there's lore. Hold on." So prep for this appointment, they told me I needed to drink
Oh yeah,
32
yeah,
ounces
yeah.
of water and not pee. So I did that, and then getting in the thing, and I'm getting so bad. Angela's like, "I don't want you to pass out because I know that that can happen. You need to tell them." He was like, you really have to go. You need to tell the girl." So I've never really done this because I'm so shy, but I went up to the receptionist lady and they asked me to hold my pee. I literally am scared I'm going to pass out. I really, really have to go. What do I do? And she was like, "Okay, I'll call the team." She calls the team and then they literally come right out and get me right at that time. But I did have to wait for like 20 minutes past my appointment time. I'm like, bro. So then I
Mm-hmm.
go back in the room with the girl before she starts doing the ultrasounds and I tell her this. "Hey, how long is this going to take? Because I'm super uncomfortable. I feel like I'm going to pass out. I feel sick." And she was like, "Oh, just go pee." I'm like, "You're fucking kidding." She's like, "Yeah, just go pee." She's like, "The people who put that in, they don't have a clinical experience. It's just a receptionist that put in that you need to drink 32 ounces of water." I'm like, "Why don't you tell them to change it?" What the fuck? She was like, "You are obviously too small to need that much." She was like, "Your bladder's too small. You don't need that much water." I'm like, ugh. She's like, "All you need is a full bladder. You don't need 32 ounces." I'm like, "What?" So, anyways, I go pee. I do the ultrasound. She's looking for my ovaries and stuff, and she's like, "I'm gonna have to press really hard, like it's gonna be uncomfortable, but I have to press really
Mm-hmm.
hard because I can't find your left ovary." She presses really hard. She finds it, and I'm like, "That's where my left ovary is, not where I expected." It's just like in the middle of my stomach more than on the side, so it's like
Mm.
under my belly button,
I feel
and
like that's true because you think your uterus is so
it's like,
big, but it's
yeah,
not.
really wide. Yeah, no, it was like right under my belly button, slightly to the left, and she's like, "Oh, I found it," and I'm like, "Nuh-uh, right there." She's like, "Yeah, that's where it is." I'm like, "Nuh-uh, that's where the spasms are." Like
Uh,
exact spot. And then she goes, "Your bladder's full. I think you might need to go to the bathroom again," because she can see it. So then
yeah.
I'm like, "Okay." So she's like, "Go to the bathroom, then we'll do the transvaginal one." Go to the bathroom, come back, do the transvaginal ultrasound. She can't obviously tell me what she sees because she does find things, but they can't tell you that. So she's
Uh-huh.
just looking around. It's horrible. I hated it. Whatever. Um, as I'm
She's
doing the
like, let me find
transvaginal,
your
as I'm
ovary.
doing the transvaginal probe, she goes, "Oh, your bladder's full again. I think you have to pee." That was the third time. So then I went pee again. I had
Well,
to
you
pee
chugged
four
so much
times.
water.
Yeah, I had to pee four plus times from the water chugging. So, anyways, that was the experience of the ultrasound. And then after that, I had a follow up appointment, which unfortunately got pushed by like a month because my
Hmm.
doctor's son had strep, so she couldn't come to work. And then she had a week vacation. I had a week vacation. And then we finally got back together. And I was like so stressed this whole time because the results went into my online portal and I read them,
Mm.
obviously,
Mm.
and I Googled
Yeah.
them, obviously, as one does. So
Yeah.
this
So
is
then
what I
you
had,
freaked yourself out when it maybe didn't
obviously,
need to be freaking
as
out.
one does. So what I found is that I had two cysts in the left ovary, which I felt so validated because I'm like, wait, my body sent a signal. I recognized the signal, and then I went to the doctor, and then they found something where the signal was being sent to.
Hmm.
Weird how it just works, but I felt so validated that it wasn't just like a mystery thing. Like as a
Hmm.
kid, I had like chronic migraines, and there was never an answer. I still don't know why, and it's just
Yeah.
so like it makes you feel like, am I even having
That's
migraines?
how I feel like every time I go to the doctor, I'm like,
Yeah,
oh, I'm just faking it.
maybe I'm just a liar. Yeah, like I feel like that all the time. So it was validating. But two cysts in my left ovary. One of them was like a normal kind of cyst, which I'm not even going to get into. And then one of them, they put in the chart possible endometrium. And I was like, what is that? That's how I got Googling and found out that that is something that's caused by endometriosis, which I've heard the word. I feel like a lot of people
Hmm.
have heard the word. I did not really understand before. So there was that in the chart, and I'm just reading this all myself and trying to digest. And then also found out that I have a retroverted uterus, which apparently 1 in 4 women
That's
do.
so cool.
Yeah, so it's 25% of women. I told Cheyenne about it. She's like,
That's probably
me
why they
too.
couldn't find your ovary.
Yeah, so instead of, which I should have put one of these pictures in, but instead of your uterus being normal or even a little bit tilted forward, mine's tilted towards my back, which I also wonder if that's why my cramps I experience as back pain rather than more
Maybe.
front cramps. I
It
don't know.
also means that when you do get pregnant, you're gonna show a lot later than normal.
Yes, yeah. And so a lot of people like there's a lot of research on these things, but I guess your retroverted uterus, some people think that it's not a good thing. Like when you get pregnant, it's going to be a problem. But I
Hmm.
guess most times it just turns to regular uterus. And then when you're not
Oh,
pregnant anymore, it goes back.
I guess that makes sense.
I guess it's pretty normal. Like people were
I feel
saying
like
that's
it
a
would just
false
mean
belief.
like instead of showing it like maybe like 15 weeks, you're
Yeah,
gonna
I
show it
think
like
that's
20
true.
weeks or
Yeah, I think that's true
something.
as well. Yeah, because it's kind of like the other way, which is so weird. So
Yeah.
interesting things. There you go. Fun facts. But yeah, so I had all that in my brain for a couple like many weeks, and then I finally went to the follow up appointment with my gynecologist, who is my favoriteest gynecologist in person. She's really, really, really good, and she gave me my results. And I'm not going to spoil them. We're just going to get into the episode because
Oh,
that kind of goes
okay.
into everything. But she gave me my results and they were a little bit inconclusive. So I have
Mhm.
another transvaginal ultrasound, unfortunately, to go back to soon. And we'll see what happens. We're just basically going to make sure it doesn't grow, it doesn't look cancerous, doesn't look weird. We don't think any of those things right now, but she's like, let's be sure, like
Yeah.
let's make sure it doesn't get change or move or maybe it'll go away. We'll see.
Yeah.
So that's coming
Like
up.
it could have
Lots to
just been
come.
like who knows where you were at in your
Yeah,
cycle previously. So like what if it was
exactly.
just that point in your cycle, that's what your
So
body looks like.
yeah, when I said I had two cysts and one was like a quote normal cyst, that is because I was ovulating at the time
Mhm.
of the thing, which is so crazy. I just can't even believe like it's weird. But I love that we've done so many episodes and I
So
understand it better now.
when we were talking about ovulating like in our period episodes, do you experience ovulation pain?
I always thought no, like I could never tell what side or anything like that, but I have been noticing sometimes I'll randomly get a little bit of back pain and I'm like, for what? I haven't been doing anything. And I'll look at my app and it says ovulation. So I don't
Mm,
know if that's a correlation or not, but maybe, but definitely not how I feel like other people might experience it. Like for me, seems mild. I don't know.
yeah, I would
Maybe
be
it
very
is.
curious. Maybe when I go to the gynecologist literally next year,
Yeah.
I just went, but when I go next year,
Yeah.
maybe I'll like say something about it because I had such bad ovulation pain my last two cycles that it woke me up in the middle of the night.
You should say something about that. Yeah, that's interesting. That's interesting.
Like,
And period pain is going to be a big thing, or like cycle pain at all is a big thing with
yeah.
endometriosis.
I think my
Um,
mom had endometriosis, so I wouldn't be
oh, really?
surprised if I
Yeah.
have it
Yeah.
too.
That's definitely one of the things is like family history, of course, with everything.
Yeah, yeah, yeah.
But all right, so we're gonna get into what endometriosis is, and then I want to show you guys this drawing from my doctor that I recreated because it's really helpful. So, very plainly, endometriosis is a condition where tissue that is similar to the lining of your uterus grows on other parts of your body. So it's basically growing in places it shouldn't be and that you don't want it to be. So when the tissue grows in those wrong places, it can cause painful symptoms that impact not only your menstrual cycle but also your daily life. And that's from Cleveland Clinic. So this is something I learned doing this episode, not from my doctor. I didn't realize this, but you can get endometriosis kind of anywhere in your body. So
Hmm.
where do people develop it? Like I only imagined it in the reproductive system because that's what we're questioning for myself. But
Hmm.
it says some of the most common places that you can get endometriosis include the space behind your uterus, your mitometrium, or a layer of your uterine wall, is what that is.
I think it's the
Ovaries.
outer layer of your
Okay.
uterine wall
Yeah.
because endo means inside.
Oh, of
So
course. That makes
myo
sense.
maybe
Yeah.
means outside.
Outside. Yeah. Ovaries. What is this? Peritoneum. I'm not sure what that is.
Peritoneum.
Peritoneum. What is that?
It's the layer over your abdomen. It's like a layer
Okay.
of like good fat that
Okay.
goes over your abdomen.
And then fallopian tubes. So these are all kind of, reproductive system area, which makes
Hmm.
sense and all I knew. But less common, but still possible places you can get endometriosis is your rectum, bladder, intestines, diaphragm, randomly, vagina, and lungs. I thought that was
Hmm.
very interesting. Like I just didn't know that.
Yeah.
So flipping back to my story time, my doctor drew this drawing right here, which she drew it on paper and in non-colorful, but I made it in a way I feel like makes a lot of sense. So you guys are going to see it on the screen. The top one would be like a quote normal uterus, and not every part of the uterus is labeled. Okay, only the parts that we're going to be talking about.
Yeah.
And then the bottom one shows an example of endometriosis. So basically, inside your like uterus, you have your endometrium that it was talking about, which is like the lining on the inside. And when that lining of your uterus kind of separates or grows or does something strange and it moves outside of just the endometrium area, like these little yellow bubbles you guys see on the ovaries or on the outside of the uterine wall, like outside of the lining, that's endometriosis. I feel like there are lots of charts, and I'm going to put in under this, I have like another example that's a more medically correct chart. So don't take my chart as like medically accurate, okay? But I think it's a lot easier to understand with two colors rather than some of these charts are very realistic looking, and it was
Hmm.
hard for me to understand what it looked like. But this very this triangular one is the one that my doctor drew, and I just feel like it's very clear, very to the point, and very much made me understand endometriosis. So basically, if you guys see on the left ovary, there's like a circle that's yellow, and that is what we are questioning that I have inside of my ovary. So I have a cyst in my ovary. We don't know what it is. We don't know if it's endometriosis, but if it were, this is what it looks like. This is what it means. So
But it could just be an ovarian cyst
it
too,
could be, yeah, it could be
just
anything.
regular.
Yep. And so the only way that we can figure that out is what we will get to in a little bit, which is a surgery. So,
Hmm.
which we're not going to do at this time. So,
Yeah.
anyways, you see on the what's it called? Video. You guys can see on the video the charts. So I'll put in the chart that I just mentioned, and then I'm also going to put in this chart that shows like a more medically accurate diagram that illustrates the same thing but better.
I hate
So,
the fingers of the
no,
fallopian
I know,
tube
me
grabbing the
too.
ovary.
I know, me too. That's why I liked her drawing. It was like so simple and so like easy to understand. Also, like it's so funny to imagine the uterus inside the body. It's really all like pushed together. Like it doesn't
Yeah,
look like a
because
triangle
like
like this, right? Like
your
it's all,
bladder sits on top of it and
yeah,
like
it's so strange to imagine.
I don't know, weird.
Yeah. So, anyways, how common is endometriosis? I just thought this was interesting. It says that endometriosis is a common condition in about 1 in 10 females worldwide. So I thought
Hmm.
that was interesting. And then it says healthcare providers most often diagnose it in people that are in their 20s and 30s. So it says the symptoms of endometriosis are often manageable with treatment. But we're going to get into how people find out they have this because it
I
is
feel
kind
like
of, oh, go ahead, go ahead.
I feel like people often get it diagnosed with it in their 20s and 30s because that's when you become like more medically aware of your body and maybe you're trying to
True.
start having kids at that time. So like
Yes,
why
that
would
is
you
it.
ever get a pelvic ultrasound unless you were like
Otherwise.
trying to figure out you wanted to like have kids?
Exactly. Yeah. And that leads us perfectly into the next section, which is like what are the symptoms and how do people find out they have this? Because endometriosis is a little bit like unknown. There's a lot of unknown
Mhm.
about it. People don't know why you get endometriosis. So for example, I'm actually going to skip to the what causes endometriosis section first, which it just says right now the cause of endometriosis is completely unknown. Nobody knows why you get this. Researchers are looking for a connection between endometriosis and other conditions like retrograde menstruation, immune system conditions, or hormone disorders as like possible factors that may lead to the condition, but there's really no true answer on why people get it. Which doesn't make it easy to deal with because it's like, why do I have this? We don't know.
Ew,
Um,
I looked up retrograde menstruation because I didn't know what it meant. And
yeah,
it's when blood from your period flows backwards into your abdomen instead of out of your vagina.
super like not fun to
Ow.
experience, I imagine. Yeah.
Yeah,
Yeah.
because like the image that they show where the fingers of the fallopian tube are grabbing your
Right.
ovaries, those are open. Like it's
Hmm.
not like completely sealed around your ovary. So it shows it going up through the fallopian tube and like kind of spitting out where those fingers are.
Yeah, I'm gonna put in a picture. You guys I actually just pulled one because it is really interesting. That does make sense though. Like now that I'm looking at the chart, I can see how that would turn into endometriosis. Like
Yeah.
that makes sense.
Yeah, because it
That's
doesn't like
interesting.
the uterus isn't a permeable membrane. It's not like it's like
Right.
floating out. It has to go out somewhere.
Right. That is super interesting. Well, I'm glad I don't have that, or at least I don't know. I guess. I guess
I mean,
maybe
you get, I guess you
you wouldn't
could, who
actually know.
knows?
Yeah.
Because like obviously you bleed
Fascinating.
outward as well. Like you have a
Right. You
period.
have
I mean,
both.
people with retrograde menstruation probably also have
Yeah.
periods, but
Yeah. No, that's interesting. All right, you guys, I put in the chart of that too. So like look at the screen if you want to see the
yeah.
visualization. Super interesting. But yeah, so researchers are looking for a connection between endometriosis and those different conditions, but still no connection, no answers. We don't know, which like I said makes it hard to kind of deal with because you don't even know why you have causation to begin with. So, as far as symptoms of endometriosis, there are many. But the most common is pelvic pain. So this can be intense or mild. I wasn't having pain, which is interesting because every time I talked to my doctor or my gynecologist, they were like, "Oh, so how often are you experiencing this pain?" And I had to keep correcting them over and over. I'm not having pain. It's spasms and it literally feels like a spasm. It doesn't hurt at all. No pain,
Hmm.
just the movement. And that was like, I think, hard for them to grasp or like connect to this because they hadn't experienced it before, especially the girl who did my ultrasound. She's like, I've never done an ultrasound because someone had cramp, like spasms in their abdomen. Like, this is just, I've never heard of this.
Hmm.
So, pelvic pain's the most common. But it says that symptoms often feel worse just before and during your period due to inflammation that's brought on by your hormonal changes at that time, which makes sense. So, symptoms of endometriosis can include very painful menstrual cramps, abdominal or back pain during your period or in between periods, which I very much experienced the back pain, heavy
Do you get
bleeding.
pain in between periods too?
No, not really. I do notice light back pain, but it seems to be correlated with ovulation, like I was mentioning, which I've only been looking at into that for recently. That'd be the only time I would say yes, but other than that, not really.
I
Um,
get abdominal pain, like it feels like period cramps. It's obviously like of a lesser
yeah,
degree, but almost weekly.
really.
Like,
I think you may need to look into this a little bit. Honestly, you have some things because those are the kind of questions though that they were asking me that they usually rely on to like get to the what is it called, diagnosis of endometriosis, is like, do you have pain between periods, and also do you have irregular periods, and also do you bleed between periods? Like those are the main things that I said no to, that they were like, we can't answer endometriosis for you.
I do sometimes spot in between periods too.
Just saying. Might want to bring
Okay,
it up.
okay.
Might want to
Okay,
bring it up
maybe I'll go to the
because
doctor
those
before
are,
next
you maybe
June.
should
Pull
just,
my leg.
it's good to make sure, but like, because yeah, I answered no to all those questions. That's kind of why we're at a like a standstill with me. But if you answered yes to a lot of those questions and I was having the symptoms I'm having, it'd be a lot easier to say that's probably what it is. Um,
Hmm.
but yeah, so heavy bleeding during periods or spotting, light bleeding between periods, pain during sex, which is called, I've never heard of that word, dyspareunia. Sorry,
No,
guys, we
no.
don't know. Um,
Dyspareunia.
one of the biggest ones is infertility, which we'll get into, and then pain while pooping or peeing. I like how it just says pooping or peeing. It doesn't say like defecating or whatever. Pain while pooping or peeing, and then stomach problems like diarrhea, constipation, or bloating. Those can all be symptoms of endometriosis.
See,
The
but all of these could also just be a normal menstrual cycle.
Yes. And you can also have no symptoms. That's another point, is that you can also have no symptoms of endometriosis and still have it, but not know until you're unable to get pregnant. And that is the
Hmm.
key that I've learned in this whole process, is that unless you're trying to get pregnant, they're probably, and unless you're having all those pains and stuff, they're probably not going to look into it. That's where we're at
Yeah.
with me, is that she was like, I don't know if you have endometriosis. And literally, the only way we would know is if you got an
Cut yourself open.
exploratory surgery
Hmm.
just to find out. Yeah. And
Yeah.
she was like, that is not something I would even recommend or consider for you. And unless you have, I think she said 2 years or 1 year, 12 months, maybe she said 1 year of trying and not getting pregnant. So if you're trying for
Hmm.
pregnancy and you can't get pregnant for like a more than a year, then you would start looking into this further.
See, but that isn't even abnormal. People that don't have
Right.
endometriosis have can
Can
sometimes
have,
take more
yeah,
than 12 months to get pregnant just because their bodies aren't like syncing up, or maybe their partner has a
right.
low sperm count. Like, who knows?
It literally can be so many things, which is so like
So, like, even if you
confusing.
were trying to have a baby and it took you more than 12 months, like, that doesn't necessarily mean it's a you
Right.
problem. And it also doesn't necessarily, even if it is a quote unquote you problem, like maybe it's not endometriosis. It's just
Right. It
so
could be something
hard.
else. It is. No, it's so wild. So, yeah, they said that there's no connection between your symptoms and then like the severity of your condition. So, you could have very few patches of endometriosis or like very light and still experience severe pain. And then other people might have like so many patches. They might have tons of endometriosis and they don't know. They don't have any pain.
Yeah.
They just can't
And
get
like you wouldn't
pregnant or
know unless
whatever.
you open up the body and check it out.
Literally, which is so wild to me. When she said that, I was like, hell no, I'm not doing exploratory surgery. Like, that's wild.
Yeah.
Luckily, I feel grateful that I don't have like bad symptoms. I can understand how someone could get to that point if they were like having the worst time,
Hmm.
dealing with it. But yeah, that's kind of interesting. And that's like the symptoms and kind of how people find out they even have it, which we'll get a little bit more into. But how endometriosis is diagnosed is, in many cases, it starts with your symptoms that we just named: painful, heavy periods, whatever might like prompt you to reach out to your healthcare provider and be like, what's going on? Like, I'm confused.
Apparently, like I should,
Yeah,
I
maybe.
guess.
And then at your appointment, it says like the provider might start asking you medical history if other people in your family have endometriosis, like Marissa was saying, and they'll do a pelvic exam. So that's kind of where I'm at. And then I might order ultrasounds or MRIs. So that is the process, and that's where we're at now. And then it's talking about different tests that actually diagnose endometriosis. So, like I mentioned, The only way to definitively diagnose endometriosis is with, okay, how do I say this?
Laparoscopy.
Laparoscopy. Yeah, laparoscopy. So this involves your healthcare provider using a small camera or a laparoscope, apparently, to look inside your pelvis, right? So they see where the tissue is, they remove some of it, do a biopsy, remove it, and then they send it off for testing. That's
Hmm.
like a way you
Just
can
to
find
make sure
out.
it actually is endometrium that's
Right. Or something
on
else.
the outside of your uterus.
Yeah. And then it says also, a surgeon will try to remove or destroy all tissue that's suspicious of
Hmm.
endometriosis, right? Because why would you not? You're already there. So in this way, a laparoscopy helps with diagnosis and treatment. And then sometimes the location of endometriotic
Hmm.
lesions may make it hard to remove without damaging, other structures or like critical parts of your body.
Like, what if they're trying to do it and it's on your fallopian tube and then all of a sudden your
Right.
tubes are tied? Like,
Yeah.
that's just like, it could
It's a little
happen.
scary. Yeah.
Yeah.
So it said that this operation may require intervention from a team of surgeons, like minimally invasive gynecologists. What is this? Colorectal
Colorectal.
surgeons or urologists. So it can get kind of dicey there because you're obviously messing with a delicate system. Everything in your
Hmm.
body, really, I feel like can be
Yeah.
a delicate system.
I mean,
So
imagine it's on your lung and then all of a sudden
yeah,
they have to fix a lesion there. And like,
right.
who knows? What if
Scary.
that hurts your lung?
Puncture.
Like, you
Yeah.
don't know.
No, it's scary. Yeah, so that's kind of like the only way to really truly know is what my doctor was telling me. Like you can guess all you want, but the only way to
Hmm.
know is to get in there and see it because you can see, like I said, I have a cyst on the ultrasound, but like Marissa was saying, that can be anything. It can be any
It
kind
could
of
be a
cyst.
regular
It could
cyst.
be
It could just be the shape
endometrium. It
of
could
your
be anything.
ovary. Who knows?
Yeah, so you can't really tell enough through that. It also says like sometimes you find endometriosis by accident. So not all people that have it have symptoms, like I said. So you might discover it in a different procedure. Like if they're doing a procedure on you for something else, they might see this endometrium somewhere in your body and realize that you
Hmm.
have it and you had no idea. So
Yeah.
very interesting. Um, that's it. That leads us into management and treatment, which is the
Yeah.
last section, but that's kind of like the most about endometriosis and what it is. So what is the treatment? Your healthcare provider can help you make a treatment plan, obviously.
Hmm.
But these are the factors that are kind of it's based upon. So the severity of the endometriosis itself, which again, you'd only know if you looked. It's kind of hard.
Yeah, I
Um,
guess it's like severity of the symptoms of potential endometriosis. So like
yeah,
they can be like, well, you're experiencing a lot of pain. Here's a medication for you to help with that pain.
yes, correct. I think it's both because it also has severity of symptoms and severity of endometriosis. So
Mm.
I guess like
Oh,
maybe if you
true.
found it through like I was saying through another surgery or something and it's like
Oh,
everywhere,
hmm.
maybe that would be, but I don't know. And then it also says your plan for future pregnancies because obviously that's a big factor that comes in is the infertility. I think like what I've heard is that's the very most common way that people find out they have it. They can't get pregnant, they ask why, and they find this.
Yeah.
Um your
And
age,
unfortunately, or maybe fortunately, when you do start like doing family planning and trying to
yeah,
have a kid, what if you get pregnant easily and you were like, oh,
right. Like,
well,
oh,
never
cool.
mind. This is
Yeah.
fake.
Yeah. No, seriously. Um, yeah, so that's a big thing that it can be based off of is like how you want to do, like Marissa said, family planning can help with how you're going to treat the endometriosis that you may or may
Hmm.
not have. Also age. And then in many cases, your treatment plan will focus more on managing pain, like you said. So like with medication, managing the pain and improving fertility. So because I'm not in pain or having any weird symptoms, there was no reason to like do a medication because it's not going to fix endometriosis. You're only treating the pain really in
Hmm.
that scenario. But medication and surgery are also possible treatment or both.
Hmm.
So then also, I didn't want to get too deep into this section because I really don't want to be like out here trying to be a doctor and telling you guys things you should do. But they did have a section in Cleveland Clinic for medications that help with endometriosis, and I just shortened it a little bit. So
Hmm.
medications can help manage symptoms. So over the counter, non-steroidal, anti-inflammatory drugs. Literally, so hard to say the whole thing.
That's why they call them NSAIDs.
Yes. So those are like ibuprofen, things like that that you've heard of. That can be helpful again with just treating the pain that you experience. And then hormonal therapies are another option, which can help with pain and suppressing your menstrual cycle. So that's like having birth control. And there was a whole list of other stuff you guys can do further research. I don't want to like list all the specific medications necessarily, but that's a big one that they suggest is like hormonal birth controls and stuff like that.
I mean, it makes sense.
Treats
If
the
you're having a
period.
lot of pain with menstruation, cut
Right.
out the menstruation. Then you
Yep.
get rid of a lot of pain. It makes
It's
sense.
literally all honestly pain mitigation at this
Yeah.
stage,
But
which makes
unfortunately, in
sense.
your circumstance, you don't have
It's just
pain.
kind of like, yeah, it's just kind of like up in the open. Like,
You're
Mm,
like, well, I'm glad I know about
okay.
it. I'm not gonna
Yeah.
freak out because like we don't
Right.
know, but
Yeah. And plus, once I have the second ultrasound and like we have more of what happened to the cyst, then we'll feel better
yeah,
or
and
we'll
like
know more.
obviously you really want kids, so like that can be
Yeah.
scary, but like
Totally.
if you do
Yes.
have this, you can't do anything about it now that you
Yeah.
have it.
And you also can
Like,
still get pregnant. It just might be a lot harder or different or slow
yeah.
or whatever. But yeah,
Yeah.
that was why I was spiraling for like 4 weeks when I didn't have the follow up from the original. I was like, this is the worst, my worst fear. Like I was freaking out. And then my provider was
Yeah.
like, made me feel so much better. So always
Hmm.
go to the doctor. Don't just take the results. Okay, go to the doctor. You guys know. But that's pretty much it. I did also just the last thing is that I included when should I see my healthcare provider, right? So like if you're thinking you're listening to this episode, maybe you're like Marissa and you're like, wait, I do have a couple of these, but I don't know. I don't know. Contact
You
the
like can't sleep at
provider.
night when you're
Yeah,
ovulating because you're in pain.
yeah,
Like you can't even touch your stomach because it hurts
is it
so
enough to
bad.
go? Like, I don't know. Yeah. Contact your healthcare provider if you have symptoms of endometriosis, like the pelvic pain or the heavy and long menstrual periods, is what it says. And a provider will help you, evaluate that. But it's a lot of things. If you're building, if you're like, oh, I have this, this, and this, and I have family history, you're building a lot of the symptoms at once, might be a good time. I always like to say, which I know everyone says this, but I always like to say better safe than sorry. Might as well rule it out. For me, I'm a big panicker a little bit sometimes. So I'm like, oh, I have to do this for my mental health. I have to like rule this out or I'm going to freak out forever. So it just
Yeah.
depends on the person too. But now you guys know about endometriosis.
Yay.
Such a random, like I said, this topic chose me. I would have never thought to do an episode on it. And I also like just didn't know much about it before at all. I just knew the
Yeah.
word and I was like, oh, scary, scary word. Didn't know what it meant at all.
Hmm.
Not as scary once you break it down, which is kind of everything. But
Yeah.
now
Which
you
I
guys
mean,
know.
it's scary but not scary because like you
Yeah,
can't do anything to fix it unless you want the surgery,
right.
which I feel like a lot of people don't opt for
The
unless
last
their
resort,
symptoms
usually.
are like very unmanageable.
Exactly.
So, and I feel like that's typically pain. Like even people that like
Yeah.
really want to have kids, they like don't get the endometriosis treated. They just figure out another way to have
Right.
kids.
Just try. Yeah.
So,
Just keep trying different things.
uh-huh.
Exactly. Different methods. Yeah. That's it, you guys. Thank you for
Yay.
listening to my basically 40-minute rant about what's going on in my life. It's literally just like a big brain dump,
What might
but I
be
love
going
it. Yeah,
on?
literally. Who even knows? So I'll
Yeah,
keep you guys posted. But
that's the
so
sad
far,
part is that you never know.
so good. Yeah. No pain for me. So I'm really like, I'm just grateful for that. And I'm just like, don't think about it too much because I'm not in pain. So I'm happy. I still get the
Hmm.
spasms. It's so weird. I'm just like, and also like the providers were like, that is just weird. Like we've never really heard of that. Our best guess is like the cyst or whatever is pressing on a nerve somewhere and that's just
Oh, and it's
causing
just like,
that. Yeah. Like,
hello.
yeah. Like it's just kind of things are pushing out of order or like pushing around too much. But they were like, that's, we've never heard of this before. So I was like, okay,
Hmm.
love being a medical marvel. Just kidding.
Well,
It's really
I'm
not that crazy,
it's
but
very interesting. I think the most interesting thing that I found out is that the retroverted uterus.
yeah.
I think that's really cool because I've heard about
Yes.
it, but never
I'm gonna
like
pull a picture
known anybody
actually.
about it.
Yes, so
No,
fun
never
fact, I have
known
that.
anybody about it. I don't know
And
what
I
I'm
have
saying
been
anymore.
looking up, like, I don't know, this isn't, it's not a direct correlation, but I have been looking up a lot of like retroverted uterus and endometriosis coming together as a pair. And it is a topic of conversation. Like, I'm not going to say that
Yeah.
there's anything findings or it's all, like I said, very up in the air with endometriosis, but a lot of people do, you know, look at the correlation between the two and see if there's anything.
Well, I think the
Um,
issue is that a lot of people don't actually get the exploratory surgery for diagnosis,
exactly.
and a lot of
Yeah.
people don't actually go through the treatment of the surgery as well. So I feel like
Yeah.
that's what makes it hard because how many people are getting opened up per year
Just, yeah, just
to
because.
diagnose or treat? So I
Right.
feel like that's what makes these research studies in particular very difficult.
Yes, I'm gonna put in you guys too. Also, there's 4 uterine positions. So
Oh,
retroverted is just one of them. So yeah, there's the normal position, and then there's anteverted, which is when it's kind of like pushing down more on like if you think of your body, your head is up and your feet are down, is what I'm saying. It's pushing down a little bit more. Retroverted is when it's up against your back, which is what I have, and retroflexed is when it's even bending further and bending down towards the back of your body, towards your butt. But
mm,
you'll see it better in the image. So yeah, the normal position is the first one, and what I have is retroverted. Isn't that interesting? I
mm.
just thought that was crazy. Like,
Yeah.
who
I
knew?
wonder, I feel like I probably have normal. I feel like that's the most common type, but I when I do have bad period cramps, I have to pee a lot more often.
Oh, interesting.
And I'm assuming that that doesn't happen to you because if your uterus is swollen, it looks like in the position that yours is in, it doesn't press on your bladder.
No.
But with a normal or with an antiverted, it looks like it could press on
Mm.
your bladder if it's
Yeah, that's interesting.
a bit inflamed.
I don't have that. And yeah, that is interesting. And it is funny to me how much this is like new to me and how much we don't learn these things in at least like our education system or like even sex ed. It's like you learn about sex and uterus, but you don't learn about all of these different
Yeah.
ways that you can
You learn about
be.
like reproduction and safe sex. You don't learn about
Right.
everything
Like
else that
the
comes
full
along with
anatomy.
having a reproductive system.
Yeah. And it's so interesting because even looking at this, I'm like, first of all, didn't know there was four ways just at all, which is
And when
really
you first
cool.
look at it, like even here, it's like, well, which side is the back of the body?
Yeah, yeah. Sorry, butt's on the right. Good call. Because even as I'm
Yeah.
showing you guys this, that's a good point. Like your butt is on the right because you can see that the white thing
The
coming down is
the
your like,
spine.
yep, spine, tailbone area right there. So that's
Uh-huh.
your butt. But no, even that's a good call. And what is also interesting is that once that you find out you have retroverted uterus or antiverted or whatever, like you just said with the bladder, you think of so many other things that you experience, and you're
Mhm.
like, wait, actually, it's probably because my body's like that.
I mean,
That's
I
why I
could not have
experience these
told you that
things.
that's what a normal position of a uterus was.
Me
I thought
either.
that it was in front of the bladder. So,
Yeah. No, I had no idea. So just interesting. So fun facts, you guys. Learning so much today. But I liked this episode. I'm glad we
yeah,
did
this
this.
is really cool.
Super fun, super educational, and hopefully I didn't make anyone go into a thought spiral with this, but
Well, I mean, I
good
did.
to be educated at least. At least now we know. We know what it
Yeah.
is. We know what it means.
Now I know that
Um,
maybe I should go to the doctor for my
yeah.
pains.
Yeah, and there's a lot of things too that's like, oh, I thought this was normal, or I thought everyone experienced a little part of this, and it's like, wait, no, not everyone does. Like even if it's mild, like, oh, I have a mild pain during this, it's like, oh, everyone probably does. Like at least mine's mild. No, not everyone does. That's fun to learn because I've been talking to my friend Cheyenne when all this went down too. I talked to her about it, and I was like, oh yeah, like I have this or that. And she's like, oh, you've always had really bad periods. I know that about you. I was like, what? And she was like, yeah, your periods are actually, you do have like really extreme pain. Cause when I used to work at Cedar Point Amusement Park, I used to have to leave work or call off work because I would just be like laying on the floor dead, like horrible
That's
cramps
how
to where
I
you like
was pre
feel.
any birth control. And
Yes. And
then
that was same. I was
ever
pre
since
any
I've
birth
been on
control.
birth control, it's
Yes.
better.
Yeah, I had that. And she was like, you've always had a bad period. And I was like, well, everybody has, because they would ask you, like, oh, do you have bad cramps or painful periods? I'm like, everybody does. Like, what do you mean? Am
But
I
you're
supposed to
also like,
know?
I don't know what's different. Like,
Yes,
I've
that's what I'm saying.
always
Like, how would you
experienced a period
know
this way.
what normal is? Like, how do I know what everyone else has? So when I talked to Cheyenne, she was like, no, in general, in my life, like, I've always made a point to not complain about my period because I actually don't have bad periods. I was like, what?
Wow.
She's like, yeah, I just make it a point in my life and like in my mind, like, I try not to complain about it because I know I'm lucky to have like not pain associated with my period and stuff. Like, I have cramps in period, but like nothing crazy. She was like,
Yeah.
you have a bad period, so this
I
doesn't
used to
surprise me.
almost throw up every time when I was in high
Yes.
school, like before I started any birth
The
control.
way I thought that was just all of us. I was just like, oh, we all have pain.
Well,
We all have to call off
the more
work.
you know.
Not
It's
true.
like that
So
meme. The more you
the more you
know.
know. Let's put it in. Yeah. And also, you guys, like, talk to your friends. That's what I'm learning is like, how else would I have known that if I didn't have a podcast where I'm talking to Marissa, talk to my friend
hmm
Cheyenne? And it's not normally something I would just bring up. But once you start talking about it, you're like, wait, oh my God, like
Well, it's
things just
like
make
even like the
sense.
taboo topics, like one of these is like pain with
Yep.
sex. And like if you aren't
Yes.
like if you don't have an open relationship with your friends to like talk about that kind of
Yep.
thing, like how would you ever know if
Literally
you
so
always
true.
experienced pain during sex and then you talk to a
You
friend
just
and they're
think that's
like,
normal.
"What?" Yeah.
Yes. So freaking true. Talk to your friends. That's the moral of the story. Talk
Nothing's
to your
taboo in a
friends.
friendship.
Yes. And if it is, you
You're
might need
not
to work on
friends.
that. Yeah, exactly. Exactly. Well, I hope you guys enjoyed this. We have to run. We have things to do today. But
Yay.
this is longer than I thought too. We've been having shorter episodes recently. So I hope you guys are enjoying this like throwback to the long eps.
Yeah, 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 yeah.
Super fun. But happy fall, you guys. As you're listening to this, we're in it. I think it's September. Let's see what day it is when you guys
It's
are
probably
listening.
like the
September
22nd.
24th. Yeah.
Okay.
So wild. So we're about to head into spooky season. Get ready for the next episode. We're going to be in theme, if you will.
About
It's
to
going to be a
head in,
fun time.
Erica, September
We're in. Oh,
1st.
my bad. We're in
What is
spooky
wrong
season.
with you?
Marissa's like, I've been waiting all year, bitch. What the hell? Yeah, you're right. You're right. You're right. We're in spooky season. We're in fall. But next week's episode will be like very on theme with spooky season. That's what I will say.
Yes.
So, hope you guys enjoyed this episode. We love you. Thank you for listening. Follow us on Instagram at We Run on Coffee to stay up to date on all the things. And that's it. I think we're out. I think we're done.
Yay.
See you guys
Peace.
later. Bye.
Bye.
And with that, I'm Erica.
And I'm Marissa.
And
And
we
we
run
run
on
on
coffee.
coffee.